Sleep is the first thing that you tend to shortchange, and you don't realize how that short-term cheating of your sleep really affects that long-term health.
Why is sleep so vital?
When we look at people who sleep well, that reduces your risk of so many things that kill us. You just feel awesome. And why would you not do something that makes you feel awesome?
Hey, welcome to In Bed with Pete Lee. I'm a stand-up comedian and I also have sleep apnea. I'm here with Dr. Sanjay.
Hey, Pete, thanks for having me here. I am a cardiologist by training, and I'm excited to have this conversation with you today.
I'm really excited to have this conversation with you, but first, how'd you sleep last night?
I actually slept pretty well. I was excited to meet you because I've been following you for years, but I've learned how to focus my energies on sleep and my routine, and just sticking to the sleep routine got me through the night, and I've got the energy to talk to you today.
I love that. So, can you help me understand why is sleep so vital from your perspective as a doctor?
When we talk about anything, be it cancer risk or insulin diabetes risk or heart disease, everything is built on a framework of proper sleep, meaning if you're sleeping correctly, your risk of all of those things go down. And when we talk in particular about cardiovascular health, most people, but not even most cardiologists, realize how central good sleep is to keeping you in good health.
So like when somebody wakes up feeling good, what happened in their brain and their heart and their body? I'm asking a smart people question.
Yeah, well, there is an interplay between our sleep, our brain, our heart. I tend to say that all arrows in biology point both ways. So your heart affects your brain affects your sleep affects your heart. All these things are coordinated. So if you're sleeping well, from a sleep physiology standpoint, what's happening is you're giving your brain time to rest, but you're also giving your body time to rest. You're allowing your heart rate to slow down at nighttime. You're allowing your blood pressure to drop at nighttime. We call that a nocturnal dipping pattern. These are all normal things that we need for our body to work correctly. And without proper sleep, none of that is going to happen. So if you don't get proper sleep, you're just going to feel off kilter. You're going to feel off balance.
Yeah. So wait, why aren't people getting good sleep if we know that it's important?
I think that there's been a remarkable underestimation of the value of sleep to all health conditions, as we talked about, but particularly when we look at the way that our bodies are meant to function. We are really designed to have to get about 8 hours of sleep a night. Now, for most people in these busy times and in this busy world, sleep is the first thing that you tend to shortchange because you've got emails to respond to, you've got shows online that you want to watch just one more episode, and you don't realize how that short-term cheating of your sleep really affects that long-term health.
And what should people look for in their lives to know that their sleep is being affected? Yeah,
so I think that for men and women, these answers are actually very different. So for guys, when we think about sleep disordered breathing and sleep issues, it's always I can hear dad snoring from a mile away. I mean, I remember I had a friend whose house we would have a sleepover at, and we could hear his dad from sleeping from 3 floors away, right? So that snoring and waking up groggy, headachy, these are things that men tend to experience. Women, though, have a different set of symptoms that they feel. So they're more likely to feel insomnia. They're more likely to feel depressed. They're more likely to feel anxious as a manifestation or as a symptom of disordered sleep breathing.
Oh, wow. All of my symptoms before I got diagnosed were the women ones.
Well, I mean, anybody can have any of the symptoms. We're all human, right? But I think particularly when it comes to educating doctors about sleep apnea, they tend to have these very defined gender roles of these are, the things that I look for here, and these are the things that I look for, in men versus women or whatever it may be. But you really have to open your mind a little bit more as a doc when we're talking about screening for sleep issues, because people can have atypical symptoms and be manifesting sleep issues.
So you covered some for men and some for women. What are some of the real red flags that say that somebody should get a sleep test?
Yeah, well, things like blood pressure are so affected by disordered sleep. Arrhythmias. In fact, in my practice as a cardiologist, anytime anyone comes to me with something called atrial fibrillation, which is one of the most common arrhythmias on the planet, the first thing I do is refer them for a sleep study because it is so highly correlative. But not only that, when you take care of the sleep apnea, the arrhythmias actually go away.
Yeah, that's actually exactly how I got diagnosed. My heart almost never beat correctly.
Yeah.
And then, they thought that I needed a more advanced thing, and it turns out that all I needed was a CPAP machine and good sleep.
And that's why I think this awareness is so important, because again, even doctors miss this all the time, that we don't have to have $1 million solutions to 50-cent problems, right? We can just do something like improve someone's sleep or check their oxygen level at nighttime and screen for these conditions that are so much more easily treatable. I mean, I think you even said they went to the extreme of saying you might need a pacemaker.
I was so relieved to find out that it was just a sleep thing.
And it's funny because you've probably experienced it as well, that sleep issues seem to carry a stigma, right? And
Yeah.
like, I don't want to be Darth Vader, and I hear this all the time from patients of mine, but I think a couple things. Number one, technology has gotten so much better, right? The machines are so much quieter. They give you so much more support to get that better sleep. You just feel awesome. And why would you not do something that makes you feel awesome?
Okay, so I want to ask you about comorbidities. It's something that I've heard about. Does that mean does that mean we both die? What does it mean?
I mean, it doesn't mean both of us are going to die, although everybody dies at some point.
Oh no, I'm just getting this news down.
It doesn't mean both of us are going to die. What a comorbidity is it's two disease states or two conditions that kind of come with one another, like peanut butter and jelly or peas and carrots, right? So oftentimes when we see someone who has sleep apnea, that will come with another medical condition like blood pressure issues or heart arrhythmias. And a lot of times when you get a bunch of these comorbidities together, you have to start thinking of what else am I missing? What am I not thinking of here? As is the case with sleep apnea. So as a cardiologist, when I see someone with blood pressure issues, arrhythmias, heart failure, I have to think of sleep apnea as one of those comorbidities, one of those other conditions that we have to screen for.
Okay, and just to be clear, does the heart condition lead to sleep apnea, or does sleep apnea lead to the heart condition? That was my case.
Yeah, great question, and it can be a chicken and the egg kind of situation. So in your case, the arrhythmias were probably brought on by not getting enough oxygen at nighttime.
Yeah.
And when you start connecting the dots between, you get blockage of your airway, that's that obstruction, a part of obstructive sleep apnea, your oxygen level starts to dip. Your blood pressure actually starts to rise because your body's saying, what's going on? I need this air. That will then start to irritate your heart, and that will then cause these arrhythmias.
So it's a blood pressure thing that led to the arrhythmia. I had no idea about that.
Well, it's this whole knee bone connected to the thigh bone cascade that happens. So when you are sleeping at night and your airway is cut off, that's a very scary situation for your body, right? So what happens when you get scared? Your heartbeat jumps up, your blood pressure goes up. That's just normal physiology. That's what's going to happen.
Yeah.
Biologically, what's happening is your body is pumping out adrenaline. We call it epinephrine. Now, that epinephrine, what that does is it constricts your arteries, meaning causes them to clamp down, which shoots up your blood pressure, and it can actually irritate your heart as well. So that those episodes of apnea that are happening, 15, 20 times an hour, are then causing all these mini elevations of these hormones in your body that can lead to blood pressure, or that can lead to arrhythmias, or it can actually lead to heart attack too.
That's literally how the sausage got made for what happened to me that led to me being diagnosed with sleep apnea. All right, now, every once in a while, I can't sleep with my machine because I'm a dummy and I forgot my power adapter on the road. What physiologically happens to me when I don't sleep with my CPAP machine?
Well, so it's not ideal, obviously, right? We want you to remain on therapy for as long as possible. But part of the reason that untreated sleep apnea is so dangerous is because people are not getting therapy, right? So these effects kind of add up. They're what we call cumulative, right? So if you miss a day or two here and there, I'm definitely not saying it's okay, but it's not that big of a deal, right?
We're talking about sleep being linked to so many things. Should sleep apnea just be tested? Should everybody have to have a sleep test?
I don't think it's a bad thing to think of this as just one of those things we have to check off, right? You get, women are getting mammograms, guys are getting colonoscopies or whatever, and then, just see if your sleep is okay, right? Maybe check in once every 10 years or so, because again, it is the bedrock on which all of our other health is based, because the outside sometimes don't match the inside, so you can't just look at someone and predict whether they're going to have sleep apnea or sleep disordered breathing. You have to do the tests. You have to get some objective idea as to what's going on.
I love that, the idea that it's a sleep mammogram that you need to take.
Sleepogram, but
sleepogram.
But why not, right? It is so important to our overall health. Consistent sleep, more importantly, consistent adequate sleep. And that reduces your risk of so many things that kill us. What are the top 3 things that kill us? Well, it's heart disease, it's cancer, and it's complications from medical procedures, right? Those are when you look at things. So when we look at people who sleep well and that don't have issues with sleep apnea, your risk of heart attack goes down, your risk of cancers go down, your risk of metabolic disease like insulin resistance and diabetes go down. And once you're owning all of those things, now you're put into a much healthier bucket that of people that are going to be able to live longer and to run after grandchildren and great-grandchildren and, you know, surf until you're in your 80s. I mean, that's really what we can hope for.
I'm 48 years old. I don't know, for someone in my age group, is there anything I need to be aware of that I need to manage for my sleep?
I mean, I think there's a lot of things, right? You know, I focus a lot in my practice on longevity medicine, and I tell people it's like the unsexy habits that really drive longevity. Getting the right temperature of your room, it's getting the right sheets that work well for you, right? So have that consistent routine and don't deviate from things. Wake up and go to bed at the same time. Then there's this whole universe of what we call sleep hygiene, is doing the things that are going to set you up correctly for sleep. Don't have a caffeinated beverage. I tell people within 8 hours of trying to get to bed. Don't exercise late at nighttime, like within 2 hours of trying to get to bed. Try to avoid alcohol if possible,
Oh,
right?
boy.
And because these are things that will affect your sleep that people don't connect the dots. Even eating that late night snack that you like to get in while you're watching, you know, the evening news, eating too late can affect your sleep as well because your body goes into this digest mode and doesn't go into the full resting mode.
I'm someone who, I work late at night, and my work hours are later. I usually don't go to bed until like 2 or 3 a.m. and I try to get my 8 hours. Is that bad at all? People always tell me you need to go to bed earlier and wake up earlier, but I wouldn't be able to go to work.
Well, you know, and we all grew up knowing early to bed, early to rise makes you wealthy and wise, or whatever that rhyme was. But for someone like you, who's performing late at night, yeah, you know what, would it be ideal for you to go to bed at 8 p.m. and wake up at 4 a.m.? Yeah, that would be ideal. It's just not practical, right? So that's where working with a sleep specialist or even a cardiologist who knows something about sleep can help, because we can help figure out, okay, for Pete, right, this is what we need to do, but for Sanjay, this is what's going to work for him, right? So it needs to be deployable in your life.
I think I'm doing a lot of things that you said wrong. I'm eating before bed. There may be alcohol here and then. Screen time, oh, it's right until I close my eyes.
Yeah.
I will literally watch an action movie right before bedtime, have coffee way too late. People always give me advice about what to do, and they're not you. They're not an expert. And so I guess I'll follow the rules if somebody really smart tells me, so I appreciate you being smart.
But it's not just following the rules, it's trying to figure out what fits, right?
Yeah.
Because if you were somebody working a 9-to-5 desk job, that would be a very different set of rules than someone who really, your main time is 8 to midnight, right? I would guess when you're doing shows, right? So we need to, and that's one of the things that frustrates me when doctors talk about sleep, is they don't take the time to realize that for this individual, what's going to work best, right? And so we need to kind of reverse engineer from your life. If there are things that we can change, then yeah, you know what, let's change them. But for someone like you who's a performer, who's working late, let's start from there and then work back and create that schedule, right? Because we're not going to put a round peg in a square hole.
Yeah, oh, that actually really helps me, because I don't know, for a long time I just thought, well, because I'm funny, I'm never gonna really get good sleep.
Yeah. No one will love me, and I'm gonna have tortured sleep for the rest of my life, right?
Yeah.
But no, but it doesn't need to be that way.
Oh, I like that, and I don't know. I'd love to get your number and we can talk after that. And I'm gonna call you every day with questions.
Every day before 8 p.m.